Good day, sir. I'm Geraldine De Hulapong, a BS Psychology 3A student of BISO MC. For today's video, I'm going to discuss about the Study Guide 1, which is about the introduction to psychology and a historical review of psychopathology. In this discussion, I'm going to focus on defining on what is an abnormal behavior, what mental disorders are, how its perspective evolved throughout history, and what is stigma and how can it be prevented. So first and foremost, what is psychopathology? It refers to one's mental life, psychological life, or behavior. From the word itself, psycho, it means mind or behavior. The study of pathology, on the other hand, is a study of illnesses or disorders. In short, psychopathology is a study of psychological disorders. What are the nature, the symptoms, or the development and treatment for that specific or certain psychological disorder. When studying psychopathology, there are some challenges that one might encounter. So, in every aspect of research or in every aspect of science, everything has its own challenges. No great results would be claimed without challenges on the road. One of these challenges is maintaining the objectivity. So, as a psychological practitioner or as a psychological student, one should consider to have a firm ground in believing or a firm ground in following the notions and objectives that he learns, because humans has its own interpretation and perception on things. So as a practitioner, you must learn to maintain your objectives and abide from it, so you won't be swayed or influenced by others. You must stand on your ground, basing on your knowledge that you learned, and make conclusion out from it. Second is avoiding preconceived notions. So, as we all know, in our society, there are a lot of notions with regards to psychology, to mental health, especially the mental illnesses or psychological disorders. In this case, you must stand firm, basing the scope of notations that you learned. You must apply it scientifically. As a practitioner, you must not be swayed by the notions or scope of notions that been aided or been provided by the folks or the culture of the people that you are in or in the society that you are in. Third challenge is reducing the stigma. Stigma refers to labeling or making label of a person or imprisoning a person with the label of a certain characteristic or psychological disorder without really knowing or dealing with the person medically or scientifically. Stigma refers to judging or perceiving other persons externally without concerning on or what might they felt inside as a human being. So what is a mental disorder? In order for us to know or to determine what mental disorders are, we need to observe these key characteristics. First, the personal distress. Second is disability. Third is the violation of social norms. And the fourth is a psychological dysfunction. First, personal distress. So what is personal distress? Personal distress refers to a person's behavior. A person's behavior may be considered as disorder if that behavior causes him great personal distress, a behavior that causes emotional breakdown. Second is the disability. Disability refers to the impairment in some areas of life. Third is the violation of norms. It is something that occurs or happen out of the norms. Is Fourth is the psychological dysfunction. Psychological dysfunction, it is a breakdown in cognitive, behavioral, or emotional functioning. It is when you have the inability to focus, to concentrate, when you have irregular mood, having emotional breakdown continually. What is stigma? Stigma also refers to the destructive beliefs and attitude held by the society that are ascribed to groups that are labeled or considered different in some manners, such like those persons with mental disorders. So stigma also refers to a form of judgment held by the society to a group of people that have these certain characteristics. So how will we know if it is a stigma? So in order to fight or prevent a stigma, we must first know and understand the things we need to learn in order to consider something as a stigma. First, we can know if it is stigma when a person distinguishes someone with a label. For example, uh, some people labeled a certain person as a crazy or a mentally ill individual. Second is when we label that someone with a label that has undesirable attributes. So, as for my example, that a certain people labeled someone as crazy or mentally disordered person. That label itself has undesirable attributes. As we all know, when we call someone crazy, that certain people we would definitely think that certain people has uh, a different kind of logic or does not thinking straight. So we automatically think that, or the society would automatically think that that person has or is harmful, dangerous. We would automatically judge them basing on what we see. And we eventually consider them as not part of the human society, or we eventually differentiate them, isolate them, or we will see them as a different person and discriminate them at worst. As a psychology student or as a psychology practitioner, we must uh, try to practice, encourage, and advocate the destigmatization of the psychological disorders. We must encourage other people to accept and embrace the effects and the reasons why there is a psychological disorders, and that psychological disorders are not different from any other types of disorders, and that we must not try to judge and hurt other people's feelings by labeling them. When can we consider that there is a psychological abnormality building or forming into someone? According to the Diagnostic and Statistical Manual 5, a system that is used to identify psychological disorders and problems, a person can have the possibility of forming a psychological disorder when he or she has behavioral, emotional, and psychological dysfunctions that is not normal or is out from the norm. And this dysfunction can lead him or her to emotional distress, personal distress, or disability to function. At this moment, we already know and discussed what mental disorders are and how at this juncture we're going to know who are the mental health professionals that can aid or can help those people that have these psychological disorders or illnesses. First, we have the PhDs. The PhDs are those clinical and counseling psychologists that are focused on teaching, researching. Next is we have the PsyDs. The PsyDs are also called as the doctor or the psychology doctor. These psychologists are clinical and counseling psychologists that is more focused on clinical treatments, um, not like the PhDs. PsyDs is more focused on treating or applying the different therapies in a clinical setting. Next, we have the RPs, the registered psychologist, the MDs, the psychiatrist. The MDs are those psychological practitioners that can prescribe uh, drugs. They are more engaged to pharmacology and more focuses on the biological states of a person that has a psychological disorder. We also have the MSWs or the social workers, the non-psychiatric and the psychiatric social workers, the psychiatric nurses, and the lay public. Each of us have the ability to give psychological first aids. If we say giving psychological first aids, it is when we help someone alleviate its personal distress or emotional distress. Now we will go to the history of psychopathology. During early times, it is believed that psychopathology or psychological disorders are brought about by demonology. From the word itself, demonology, which means demons. It is a doctrine that an evil being or spirit dwells on a person and controls its mind and body. And as we know, demonic possession and control are handled or being taken over by the church. Designated person from a church treats them through exorcism. We are all familiar with exorcism, right? Ritualistic casting out of the devil or evil spirits. Back then, they also believed that psychological disorders can be treated through trepanation, a process wherein a person or a patient with psychological disorders skull were dug or being cut with the belief that evil beings or spirits come out from that certain holes in your skull. They also believed in the process of hydrotherapy. It is a process wherein a patient's senses is brought back in a way of pouring or submerging them into an ice cold water. Now we'll move on to the Dark Ages. In the Dark Ages, the church is considered as the light who fights witchcraft or witches. And at those times, witches are being tortured and executed. They are hanged from a pole and then being burned. In 13th century, lunacy trials began in England. Lunacy trials refers to trials wherein higher authorities conduct trials to the people to test them if they have or to test the people's sanity. These trials are used to protect the people from having mental disorders or psychological disorders. They conduct trials to know whether the people have this psychological disorder, and if it is proven that they have these psychological disorders through the trials, then that person will be isolated, will be imprisoned, or eventually be killed. During those times, mass hysteria also occurred. When we say mass hysteria, it refers to a large scale of outbreak of bizarre behavior. An example of this is that in Europe, a mass hysteria occurred wherein a whole group of people are compelled to run in the streets, to dance, to jump, to shout, as if there is a wild party at late at night. And the most odd thing is that they are jumping, dancing, running on the street without music. So as I've said, mass hysteria is when a mass of people showing odd or bizarre behaviors. As time passed by, there is a development of asylums. Asylums are establishments wherein the patient with psychological disorders are being taken care of and confined. Example of this asylum is the Saint Mary of Bethlehem. Saint Mary of Bethlehem is one of the first psychological institutions. Saint Mary of Bethlehem is located in London. A sad part of it is that today, the first mental institution is now considered as one of London's greatest tourist attractions. Moving on to Pennell's reform and moral treatment. Philip Pennell is the one who pioneered the humanitarian treatment. He is the pioneer to treat patients with mental disorders as a sick persons and not as a beast. He engages a moral treatment wherein patient engages in purposeful and calming activities such like gardening or letting them talk to some attendants. So let's move on to the early foundations of psychological disorders. We will focus first on the biological approaches. General paralysis is a degenerative disorder that has psychological symptoms that is brought about by syphilis. And as we all know, syphilis is a skin disorder. So, since general paralysis has a biological cause, then maybe other mental illnesses also has a biological cause. Next is genetics. Galton's work leads to notions that psychological disorders can be inherited. Next is we have Emil Kraepelin. He pioneered the classification of mental illness based on biological cause. He also published the first psychiatric test. He derived to a conclusion that mental illness is a syndrome, and he proposed two syndromes, the dementia praecox and manic depressive psychosis. Let's move on to the psychological approaches. First is to have Freud's psychoanalytic theory. According to him, human behavior is determined by unconscious forces. He also has the structure of the mind, which is the id, ego, and superego. Id refers to one's libido or pleasure. The ego that balances the id and the superego, or also known as the reality principle, and the superego that refers to one's conscience. And then we have the rise of behaviorism. We have John Watson's behaviorism that has emphasis on learning rather than innate tendencies. Ivan Pavlov's classical conditioning that refers or emphasizes learning through association. We have B.F. Skinner's principle of reinforcement, which have the positive and negative reinforcement, or the punishment and reward system. We also have Albert Bandura's modeling, which emphasizes learning by imitating others' behavior. It is also concluded through his experiment called the Bobodal experiment. All of these approaches are further developed, studied, and discussed up to this day. This is the end of my discussion about the introduction to psychopathology historical review. Thank you for watching. I hope you pick up something and that you understand something about my discussion. Thank you and God bless.